Congratulations, Alliance, on your 20th anniversary. It's hard to believe that it's been 20 years since I had the idea to create the Alliance to ensure that wound care had a credible, collective voice when speaking with regulatory agencies such as CMS, FDA, as well as Congress. I am proud that we have been able to build a collaborative association that relies on consensus and discussion with all of our members' input. Our key initiatives have been and continue to be coding, coverage, and payment, and wound care research. We have had some incredible successes representing the wound care community, with our focus always being to advocate for and help the patients whom our clinician members treat. Here's to driving change and moving wound care forward for another 20 years.
Hi, I'm Dr. Caroline Fife, and I want to wish the Alliance happy 20th anniversary. I've co-chaired the Alliance for more than half of its 2 decades, and I'm incredibly proud of all that's been accomplished. The Alliance works tirelessly on behalf of its members to educate regulators and payers about the importance of wound care, and has achieved great success in the coding, coverage, and payment challenges that impact both providers and patients. I can't imagine where we would be without the work of the Alliance, and no other organization represents the entire wound care industry. We played an important role in the 2005 CMS MedCAC on the usual care of chronic wounds, and in 2009 on the MedCAC on lymphedema. We published the Power Paper on consensus standards for wound care research, and published the first comprehensive analysis of the cost of chronic wound care among Medicare beneficiaries. We respond to more proposed rules than I can even count. Thank you, Alliance, for all that you've done for the field, and here's to 20 more years of advocacy.
I just can't get over all of the amazing good work that we accomplish on behalf of our beloved wound care patients. We have truly changed policy and practice, and it is a privilege and an honor and a joy to serve on this board and to help make wound care better for everyone involved.
When I think about the Alliance and the work that you all have done, it's really so passionate and knowledgeable and patient-centered. It's really actually inspiring, coming from a different perspective on the legal side, to see the work that you do on behalf of patients in the industry overall.
It's been a great 20 years, and the Alliance has certainly come a very long way. The Alliance has demonstrated what a powerhouse the Alliance is. You show so much value to the wound care community, and so everybody should be celebrating the 20-year anniversary, because without the Alliance, wound care wouldn't be what it is today.
During my career in CMS leadership, the Alliance worked closely with the agency to promote a number of important changes in policy and coding procedures that had a meaningful impact on patients, allowing for improved access to new healthcare technologies and therapies. I just wanted to say thank you for all of your work on behalf of patients and providers everywhere, and keep doing what you're doing. Thank you.
As a DME MAC medical director for more than 12 years, I could always depend upon you to be a credible resource, providing current scientific knowledge about the complexities of the wound care industry. You've always answered my questions and have created educational sessions for me and my clinical staff, all of which contributed to updates made to the surgical dressings local coverage determination. I am thankful also that you've always kept the special needs of Medicare beneficiaries in the forefront.
Over the years, the Alliance has advocated for clinicians and manufacturers, bringing a respected and credible voice to regulators and policymakers. The Alliance somehow always seems to be the first to know and never hesitates to provide a heads up on what this may mean to our organization. You make our jobs much more tenable, helping us break down complex regulatory language so that we can make informed decisions about our CTPs. Congratulations on your 20th anniversary. Couldn't do it without you.
Congratulations. Thank you for being that voice, making it easier for everyone in the environment, including the regulators, to have one place to go, to hear, to learn, to get together, and to serve the important patient groups that we serve.
Well,
The Alliance has really helped the industry to move the needle forward on wound care. They're now the first persons who are like the lighthouse, the warning signal. They're the ones who alert us as industry. They have now become recognized and are the entity that the government resources, whether it's FDA or CMS, looks to go as the one-stop shop source of all things wound, to get the conversation started, to get their input, being there to testify, to make statements at the right time, and to write the letters and to bring many of the issues before we many times realize this is an issue, and then to get the whole community together to understand and to collaborate around how is this going to impact our industry and really look at it out into the future.
What an incredible 20 years the Alliance has had. Thank you to all of our members who have helped us impact change and access to products and services like debridement, CTPs, disposable negative pressure, surgical and antimicrobial dressings, hyperbaric compression, and so much more. We will continue to be your wound care watchdog and build consensus through collaboration. We may be small, but we are nimble and able to address issues quickly. Happy anniversary, Alliance. Here's to 20 more years of working together.
So when I think of the collaboration between the clinicians and industry, it gives us the opportunity to look at the needs on both sides. And so the ultimate goal is to care for the patient, to make sure that the patient has access to all therapies. And so by working together, that helps up, and then having a third party to pull us all in together has been just very beneficial.
The Alliance is a really unique organization in the way it bridges the industrial partners and the clinical organizations, really for the benefit of all of us, to find common ground and to scrutinize policies, both commercial and governmental, that allow us to do what we want to do, which is really getting access for our patients.
The Alliance really gives industry a seat at the table when you have conversations with CMS or other insurance payers. It's extremely valuable. It's not something we can do. And I like it because it's agnostic to products, and you find yourself working with people that are actually competitors in the marketplace, but you're driving for the same thing.
I first met Marcia September of 2019 when we were at a PDAC meeting in South Carolina, and we were all down there trying to educate our government colleagues and collaborators on lymphatic management. And I just saw back to that empowerment component, I saw Marcia's ability to connect, collaborate, and empower everybody in the room to understand that patient outcomes are the focus of why we're there.
CMS was paying for CTPs inconsistently, and it was awarding codes inconsistently, and it was very confusing, and nobody understood what CMS was doing, and we thought it was important to share our views with CMS, and hopefully that they would then make some changes. And I think the value of this is if any provider had gone singly, they may not have made the impact or even gotten the meeting. But when the Alliance asked for the meeting, every single segment of CMS that was impacted by this did show up at the meeting and did listen. So I think
that's pretty awesome.
Yeah, I think it was awesome, don't you?
It's hard to believe 20 years have already gone by. I also want to congratulate the Alliance for convening such a successful and very innovative Wound Care Evidence Summit just last year. It was incredible to have all the stakeholders, including the regulators, in the same room so that we could all discuss what the challenges are for getting effective wound care products into the marketplace successfully.
Thinking about what value this adds to the field, it's a rare opportunity that you get to have world-leading professors of research, CEOs of industry, consultants from this field of reimbursement of medical devices, directors of government agencies and funding agencies like FDA and NIH, all being able to sit together in the same room, talk and share ideas about how we as a field, from the clinical care providers, to the researchers, and to the patient stakeholders to advance access together to treat patients better.
I really thank Alliance because during COVID, when our hospital was saying that we are going to get shut down, they worked very hard. We all worked very hard, and within 3 days, we were able to write a paper saying wound care is an essential service, and we never closed.
Public policy can feel overwhelming and confusing. It feels good knowing that the Alliance is out there advocating for me and my patients so that I can focus on delivering the best evidence-based care that I can.
On behalf of the European Wound Management Association, I am, as the Human Director, very pleased to congratulate the Alliance, and I'm sure that we will continue our fruitful collaboration, and I send you our best wishes.
And I'd like to congratulate Marsha and the Alliance of Wound Care Stakeholders on the 20th anniversary.
Happy anniversary, Alliance!
Happy 20th anniversary to the Alliance. Here's to many more years.
Here's to perspective in making a difference, because I think that's what the Alliance has done since day one. I think when Marsha kind of first started all this. So listen, onward and upward, and here's to making a difference.
As we go into the 20th, I want to say to the members, first of all, thank you for being members. You have realized and do realize the value of membership in the Alliance and what it has to contribute to you, your associations, your practice, to everything that you do. To the people that aren't members, come on, get on board. Are you kidding? This is the roadmap to any problems you have in wound care. This is how we get it done, by teaming together, being together, and getting it done together. Because nobody in wound care has the contacts or the persistence that the Alliance has.